Today we're going to start a very important topic which is related to the oral medicine. The chapter name is Disorders of Blood. So let's start. Bismillahirrahmanirrahim. Okay. Sometimes what happened that there is an oral signs and symptoms due to any blood disorders. Either it is a sore mouth, painful tongue. It because of any type of anemia which is okay. So basically, the lesions of oral mucosa may occur in patients with the abnormalities of blood. Okay, I have told you. Then anemia. Anemia is basically the decreased Hb concentration of the blood which is below the normal. In male, you have seen this is 11. This is 13 to 18 and gram per dl, and in females it is 11.5 to 16.5 gram per 100 ml. Okay, which is very important. Remember these values. Okay. Number one, there is a chronic blood loss due to menorrhagia. Sometimes patient suffers from excessive or a chronic menstrual blood loss, so the patient can suffer from anemia. Then there is also a GIT bleeding due to any ulcer or carcinoma. There is also a urinary tract bleeding and also liver disease. Number one, very important point. The second is basically excessive destruction of RBCs. The breakdown of RBCs, hemolytic anemias like sickle cell anemia, and then you have thalassemia. Poor intake of hematinics. Hematinics are basically, you can say, the iron supplements or the nutrition substance. So it is basically not properly consumed, like you do not properly consume the iron or vitamin B12 or folic acid, and you are taking alcoholism food. Okay. Then drug associated is number one alcohol, then the second is barbiturates. Okay, methotrexate and phenytoin causes folic acid deficiency. Very important point. It causes the folic acid deficiency. Folic acid, phenytoin also, remember, one side effect is also the hyperplasia of gingiva. Okay. Then there's a there's an increased demand for hematinics. Means during pregnancy there's a lot of importance for the consumption of nutrients by pregnant women, so there's an increased demand, that's why also. Malabsorption basically occur in celiac disease and Crohn disease. Like vitamin B12, you can take it. Vitamin B12 not properly absorbed because its absorption depends on the intrinsic factor which is produced by the gastric mucosa. Okay, sometimes the gastric mucosa do not produce the intrinsic factor, due to which there is no absorption of the vitamin B12. So the patient suffers from the vitamin B12 deficiency, and then it suffers from pernicious anemia. Okay. Rheumatoid arthritis is a common cause. Then genetic, there is a beta thalassemia. Okay. So we'll study in upcoming the type of thalassemia. So it is one of the type. Hypochromic, basically there is a decreased HB in the RBCs. Okay, means HB level is less. Microcytic means small size. And okay, rise susceptibility to infection. When you have a rise susceptibility to infection, you suffers from anemia, bleeding disorders like leukemia. Then aplastic anemia, which is actually a failure of the bone marrow. Okay. Normochromic and normostatic means that there is a normal HB and normal size of the RBCs. Vitamin B12 deficiency is due to pernicious anemia, which I have told you. Now there are different types of anemias like iron deficiency, pernicious anemia. Then you have actually folic acid deficiency or sickle cell trait. Okay, some very important points which is very important is actually to remember is what number one, microcytic anemia. Okay, microcytic anemia, you have to remember it is a microcytic anemia. Iron deficiency is a microcytic anemia, which is most commonly due to chronic menstrual blood loss or women bearing the child age over, and men which suffer from peptic ulcer or hemorrhoids. Means hemorrhoids is basically the swollen veins. Okay, basically. Okay, hemorrhoids are basically swollen veins of the rectum, and it causes a discomfort of pain. Now, pernicious anemia, remember, more common in men, but it is a microcytic anemia. Micro, macro. Okay, macrocytic anemia, and it causes neurological diseases like facial nerve palsy, Bell's palsy, etc., and also a degeneration of spinal cord. The pernicious anemia suffers from two type of things: neurological diseases and also subacute combined with degeneration of spinal cord. Folic acid deficiency, which is microcytic anemia, present in younger people or pregnant women. Okay, microcytic. Okay, basically. Then sickle cell trait is most common in migrants, which is from West Indies, and thalassemia is also common in immigrants, but from Mediterranean Sea. So remember, iron deficiency is micro, pernicious, and folic acid is micro, micro. Okay. General symptoms. Initially, patient is symptoms free. There's a tiredness, tangling or numbness in your extremities, high light headache, faintness, tachycardia, palpitation, chest pain on exertion, and also basically shortness of breath on the exertion. Remember, the patient has a brittleness with colonna chai. Colonized chai means a spoon-shaped nails and also paler in color. Sickle cell anemia is a suffers with a painful crisis. Acha, okay, the painful crisis. Acha, what are actually painful crisis? It is basically refers to a sudden or severe episode of pain in individuals which suffers with the sickle cell disease. Okay, it is basically the episodes of pain in individual suffers. Sore tongue, painful tongue, sore mouth, difficulty in swallowing. Basically, it is also in Plummer Vinson syndrome, which is an iron deficiency. Okay, oral signs is basically atrophic glossitis, smooth inflamed tongue. One. Atrophic means decrease in size, and glossitis inflamed tongue. So it gives appearance of smooth inflamed tongue. Angular cheilitis is more common in folate and iron deficiency than pernicious anemia. Okay, oral ulceration, then oral candidiasis and glossitis and stomatitis, which is marked in beta 12. Remember, patient with beta 12 deficiency is glossitis, stomatitis, pernicious anemia. It suffers it actually में. Okay, Plummer syndrome, Plummer Vinson syndrome, dysphagia, glossitis with together with the iron deficiency anemia. Okay, so patient also suffers from the iron deficiency anemia and paler oral mucosa. Okay, then you have some they have actually told you that this is the oral signs symptoms of hematinic deficiencies. People that suffers from folic acid, iron deficiency, or any glossitis is basically inflamed tongue will also occur, but in combined with smooth depopulated tongue in iron deficiency. Patient with the iron deficiency will have a depopulated tongue, means there will be no papilla. In beta 12 and folic acid, you have a raw beefy tongue. Raw and there's a row beefy tongue. Okay, oral candidiasis including angular cheilitis, exacerbations of recurrent epistomatitis, means the patient has a very worse condition. Plummer Vinson syndrome is a Patterson Kelly syndrome, iron deficiency. Okay, then you have three type. There are stages of iron deficiency. There are some mistakes in this slide, so listen me carefully. You have three stages. Number one is pre-latent stage iron deficiency, in which the stores of irons are depleted, but the HB and serum ferritin level remains within the normal. Okay, in next stage what happens, then there's an body stores of iron is exhausted, and here the serum ferritin is reduced but HB is still same. Okay, then you have the uh, latent iron deficiency, in which iron stores are exhausted, serum ferritin is reduced, and the HB is now decreased. The HB level is now decreased in this. Okay, then you do a diagnostic test to confirm something. if you have to confirm that the patient is suffering from the iron deficiency, so what you will do, you will do the full blood count to show the HB of the men and women. In men, I have told you the HB is basically 13 to 18, and in females it is 11 to 16. Okay, red blood cells. Okay, the parameters is basically mean corpus corpuscular volume, and the second we have the mean corpuscular hemoglobin concentration. Okay, so you will see the values of these, right? Now in you will also see the packed cell volume hemocrite is basically the proportion of the RBCs in the blood. Okay, if it is high, so it indicates that it is polycythemia, or if it decrease means, if the packed cell volume is less means you are suffering from anemia. Okay, now serum ferritin and serum iron levels are reduced in iron deficiency anemia, but the total iron binding capacity is rise. Why? Let's see. So first you should know what is the total iron binding capacity. Is basically blood test that measures that the total amount of protein, means that this is the total amount of protein available for binding to iron, right? Means if it is raised means the patient is suffering from the anemia, means the body is produces more transferrin to bind to available iron, because iron is less. Okay, and the body is basically produces more transferrin. So what happens in total iron binding capacity when the iron levels are low? Basically, so the liver produces more transferrin, a protein that binds to iron and transport it to a various tissues. Means the iron stores are low. The transferrin works as a vehicle. So it produces more transferrin to make it available to or to spread it to more tissues. Okay, so if it is raised means that the body is producing more iron, more transferrin to use the available iron. Okay, then vitamin B12 deficiency is a megablastic anemia and microcytic anemia. You will also see the decreased levels of the vitamin B12 levels. Then you have positive chilling test. uh, Okay, so basically, what is this test? It is basically a medical test used to assess the body's ability to absorb vitamin B12. Sometimes, when you have this positive, the patient is actually suffering from some disease. Either it is celiac disease or Crohn disease, because vitamin B12 is not observing. Okay, so basically for its absorption you need an intrinsic factor which is produced by gut mucosa, but it is not available, so vitamin B12 will not absorb. Okay, now folic deficiency also causes megablastic anemia with macrocytosis. Means you have megablastic anemia plus you have increased size of this also. Okay, macrocytosis is basically enlarged RBCs. Then you have basically red cell folate value are low, basically. Okay, and basically means you have low red cell folate, which indicates the folate deficiency within the RBCs. Then sickle cell anemia is confirmed by HB electrophoresis. It can be asked in your viva that how you can confirm the sickle cell anemia. So you will see HB electrophoresis, and other investigations may be also carried.